AAPC CPB Certification Exam Prep, based off Practice Exam 1. Question 1. What does HMO stand for? Option A, Health Management Office. Option B, Health Maintenance Organization. Option C, Human Maintenance Organization. Option D, a Health Management Organization. The correct answer is option B, Health Maintenance Organization. Health Maintenance Organization. Question 2. What does PPO stand for? Option A, Physician Provider Organization. Option B, Physician Provider Office. Option C, Preferred Provider Organization. Option D, Preferred Provider Office. The correct answer is option C, Preferred Provider Organization. Preferred Provider Organization. Question 3. What does EPO stand for? Option A, Exclusive Provider Organization. Option B, Executive Provider Organization. Option C, Exclusive Patient Organization. Option D, Executive Patient Office. The correct answer is option A, Exclusive Provider Organization. Exclusive Provider Organization. Question 4. What does POS stand for? Option A, Point of Sale. Option B, Point of Service. Option C, Place of Service. Option D, Place of Sale. The correct answer is option B, Point of Service. Point of Service. Question 5. What TRICARE option is available to active duty service members? Option A, TRICARE Young Adult. Option B, TRICARE for Life. Option C, TRICARE Select. Option D, TRICARE Prime. The correct answer is option D, TRICARE Prime. TRICARE Prime. Question 6. What TRICARE option S are available for active duty family members? Option A, I and 3. Option B, 2, 4, and 6. Option C, 2, 3, and 4. Option D, 3. The correct answer is option C, 2, 3, and 4. Options include TRICARE Select, TRICARE Young Adult, and TRICARE for Life. Question 7. A document provided to Medicare patients explaining their financial responsibility if Medicare denies a service is A, N. Option A, Advance Beneficiary Notice. Option B, Insurance Waiver. Option C, Notice of Financial Liability. Option D, Explanation of Benefits. The correct answer is option A, Advance Beneficiary Notice. Advance Beneficiary Notice. Question 8. What is an Advance Beneficiary Notice, ABN? Option A, a written notice given by a physician or provider to a Medicare patient before providing certain services. Option B, a bill sent to the patient after the service is denied. Option C, a contract signed by the provider to accept Medicare rates. Option D, a notice of privacy practices provided at registration. The correct answer is option A, a written notice given by a physician or provider to a Medicare patient before providing certain services. A written notice given by a physician or provider to a Medicare patient before providing certain Part A or Part B items or services. Question 9. What is an explanation of benefits, EOB? Option A, a bill sent by the doctor to the patient. Option B, a statement sent by an insurance carrier explaining what medical treatments and/or services were paid for. Option C, a request for medical records from the insurance company. Option D, an authorization form for surgery. The correct answer is option B, a statement sent by an insurance carrier explaining what medical treatments and/or services were paid for. A statement sent by an insurance carrier to the covered individuals explaining what medical treatments and/or services were paid for on their behalf. Question 10. Which act protects information collected by consumer reporting agencies? Option A, Equal Credit Opportunity Act. Option B, Fair Credit Reporting Act. Option C, Fair Debt Collection Practice Act. Option D, A Truth in Lending Act. The correct answer is option B, Fair Credit Reporting Act. Fair Credit Reporting Act. Question 11. What does the Fair Credit Reporting Act protect? Option A, healthcare records in a hospital setting. Option B. Information collected by consumer reporting agencies such as credit bureaus and medical information companies. Option C. Equal opportunity for all credit applicants. Option D. A truthful disclosure of lending terms. The correct answer is option B. Information collected by consumer reporting agencies such as credit bureaus and medical information companies. Protects information collected by consumer reporting agencies such as credit bureaus, medical information companies, and tenant screening services. Question 12. What is the Truth in Lending Act? Option A requires lenders to disclose credit terms and use uniform methods for computing the cost of credit. Option B requires providers to report all medical errors. Option C protects against identity theft. Option D ensures all medical bills are paid within 30 days. The correct answer is option A. Requires lenders to disclose credit terms and use uniform methods for computing the cost of credit. Requires lenders to disclose credit terms and for the creditor to use uniform methods for computing the cost of credit. Question 13. CMS has a standard enrollment form in which the provider agrees to several conditions. Which set of conditions is correct? Option A. Submit claims to Medicare, have beneficiary authorization, retain records, and correct claim discrepancies. Option B. Submit claims within 60 days, have authorization, and use group NPI only. Option C. Retain source documentation, submit within 90 days, and use group NPI. Option D. Research discrepancies, submit claims within 30 days, and use personal NPI. The correct answer is option A. Submit claims to Medicare, have beneficiary authorization, retain records, and correct claim discrepancies. Provider agrees to submit claims, have authorization, retain source documentation/medical records, and research/correct claim discrepancies. Question 14. What does CMS stand for? Option A is Centers for Medical Services. Option B, Corporate Medicine Service. Option C, Centers for Medicare and Medicaid Services. Option D is Center for Medicaid and Medicare Service. The correct answer is option C. Centers for Medicare and Medicaid Services. Centers for Medicare and Medicaid Services. Question 15. What does MAC stand for? Option A, Medicaid Administrative Contractors. Option B, Medicare Administrative Contractors. Option C, Medical Administrative Contractors. Option D, Medicare Administrative Corporation. The correct answer is option B, Medicare Administrative Contractors. Medicare Administrative Contractors. Question 16. What are the provisions for submitting Medicare claims electronically to MACs? Option A, submit claims only for authorized beneficiaries, ensure entries associated with source documents, and correct discrepancies. Option B, submit claims within 10 days, use personal ID numbers, and do not retain records. Option C, be responsible for all claims, submit without authorization, and use any NPI. Option D, ensure entries are based on verbal reports and ignore discrepancies. The correct answer is option A. Submit claims only for authorized beneficiaries, ensure entries associated with source documents, and correct discrepancies. Includes responsibility for claims, beneficiary authorization, associate entries with source documents, retaining records, accuracy, NPI use, and correcting discrepancies. Question 17. What does EAPS stand for? Option A, Early and Preparative Screening, Diagnostic, and Treatment. Option B, Early and Periodic Screening, Diagnostic, and Treatment. Option C, Key and Preparative Screening, Diagnostic, and Treatment. Option D, Early and Procedural Service, Diagnostic, and Treatment. The correct answer is option B, Early and Periodic Screening, Diagnostic, and Treatment. Early and Periodic Screening, Diagnostic, and Treatment. Question 18. The Early and Periodic Screening, Diagnostic, and Treatment, EAPS, benefit provides services for which age group? Option A, children under age 18. Option B, children under age 21. Option C, adults over age 65. Option D, all Medicaid beneficiaries. The correct answer is option B, children under age 21. Children under age 21. Question 19. What is another word for CATAM? Option A, fraud. Option B, defense. Option C, whistleblower. Option D, abuse. The correct answer is option C, whistleblower. Whistleblower. Question 20. What is the Stark Law? Option A, prohibits physicians from self-referral for certain services. Option B, prevents kickbacks for referrals. Option C, requires disclosure of credit terms. Option D, protects consumer credit reporting. The correct answer is option A, prohibits physicians from self-referral for certain services. Amendment to SSA that prohibits physicians from self-referral when sending patients elsewhere for certain services. Question 21. Which question is asked to determine a violation of the Stark Law? Option A, is there a kickback? Option B, is there a conflict of interest? Option C, is the credit term disclosed? Option D, is the patient under age 21? The correct answer is option B, is there a conflict of interest? Stark Law. Question 22. What does the Anti-Kickback Law do? Option A, makes it a criminal offense to reward referrals of items reimbursable by a federal healthcare program. Option B, prevents physicians from referring to their own clinics. Option C, regulates the interest rates on medical loans. Option D, requires providers to submit electronic claims. The correct answer is option A, makes it a criminal offense to reward referrals of items reimbursable by a federal healthcare program. Makes it a criminal offense to knowingly or willingly offer, pay, solicit, or receive any remuneration to induce or reward referrals. Question 23. Which guidelines apply to ensuring compliance with the Medicaid program? Option A, Medicaid is covered only by federal guidelines. Option B, Medicaid is covered only by state guidelines. Option C, both federal and state guidelines apply to Medicaid. Option D, Medicaid is only covered by international guidelines. The correct answer is option C, both federal and state guidelines apply to Medicaid. Both federal and state guidelines apply. Question 24. True or false, under the Medicaid program, state guidelines take precedence over federal guidelines? Option A, true. Option B, false. The correct answer is option B, false. Federal guidelines generally set the baseline that states must follow. Question 25. True or false, under the Medicaid program, state guidelines cannot contradict basic federal requirements? Option A, true. Option B, false. The correct answer is option A, true. State guidelines must align with federal standards. Question 26. Which of the following is listed on a Medicare card? Option A, patient name, Medicare claim number, effective date, sex, and entitlement part. Option B, patient address, phone number, and primary care physician. Option C, current medications and blood type. Option D, insurance premium amount and employer name. The correct answer is option A, patient name, Medicare claim number, effective date, sex, and entitlement part. Includes patient name, Medicare claim number, effective date of coverage, sex, and entitlement, Part AB. Question 27. What does ACO stand for? Option A, Affordable Care Organization. Option B, Accountable Care Organization. Option C, Accountability Care Organization. Option D, Accountable Care Order. The correct answer is option B, Accountable Care Organization. Accountable Care Organization. Question 28. What is an Accountable Care Organization, ACO? Option A, an insurance carrier that provides a set fee based on the diagnosis of the patient. Option B, groups doctors, hospitals, and other health care providers who coordinate high-quality care to Medicare patients. Option C, a group of providers who contract with a third-party administrator to pay fee-for-service for services. Option D, hospitals that see a subset of patients for cost efficiency. The correct answer is option B, groups doctors, hospitals, and other health care providers who coordinate high-quality care to Medicare patients. Groups of providers who coordinate care to ensure high quality and efficiency for Medicare patients. Question 29. What does MUE stand for? Option A, a medically unlikely edit. Option B, medicine units addition. Option C, medical unit edits. Option D, a medically unlikely addition. The correct answer is option A, medically unlikely edit. Medically unlikely edit. Question 30. What is an MUE for a HCPCS/CPT code? Option A, maximum units of service that a provider would report for a single beneficiary on a single date. Option B, the minimum number of tests required for a diagnosis. Option C, the edit used to identify duplicate claims only. Option D, a code used for unusual medical circumstances. The correct answer is option A, maximum units of service that a provider would report for a single beneficiary on a single date. Maximum units of service reported under most circumstances for a single beneficiary on a single date of service. Question 31. If a surgical procedure was an emergency but required pre-authorization, what is true for most payers? Option A, the surgical services will not be paid if not pre-authorized. Option B, the entire claim will not be paid. Option C, it is acceptable to obtain authorization following the surgery. Option D, pre-authorization is not required at all for emergencies. The correct answer is option C. It is acceptable to obtain authorization following the surgery. For emergencies, many payers allow retroactive authorization. Question 32. Is it appropriate to have a written office policy to write off all patients' coinsurance and copayments? Option A, yes, if it is a written policy and everyone adheres to it. Option B, no, it is in violation of Stark law. Option C, yes, if it is a policy in writing it must be followed. Option D, no, it is considered fraud to write off the responsibility for all patients. The correct answer is option D. No, it is considered fraud to write off the responsibility for all patients. Routine waivers of copayments/coinsurance can be considered fraudulent. Question 33. What three documents are needed to verify a patient's demographic information? Option A, insurance card, demographic form, and photo identification. Option B, social security card, birth certificate, and utility bill. Option C, medical records, prescription history, and credit report. Option D, employer ID, tax returns, and marriage license. The correct answer is option A, insurance card, demographic form, and photo identification. Insurance card, completed demographic form, and photo ID, driver's license. Question 34. What should a biller do when a claim is denied for being outside the timely filing period? Option A, track the transmission date. If within the period, provide info to payer to reprocess. Option B, write off the claim immediately. Option C, resubmit with a different date of service within the period. Option D, transfer the balance to the patient. The correct answer is option A, track the transmission date. If within the period, provide info to payer to reprocess. Verify the transmission date and provide proof if it was submitted on time. Question 35. What two actions can be taken if a claim was received by the payer within the timely filing period but denied? Option A, reprocess the claim or file an appeal. Option B, delete the claim or bill the patient. Option C, change the CPT codes or use a different NPI. Option D, notify the state board or ignore the denial. The correct answer is option A, reprocess the claim or file an appeal. Reprocess or appeal. Question 36. What date format is used to determine the primary insurance using the birthday rule? Option A, month and day. Option B, month, day, and year. Option C, day. Option D, month and year. The correct answer is option A, month and day. Month and day. Question 37. Using the birthday rule, Joe, February 23, 1987, Mary, April 4, 1984, who carries the primary insurance? Option A, Mary, because her date of birth is the 4th. Option B, Joe, because he is the male head of the household. Option C, Mary, because her birth year is before Joe's. Option D. Joe, because his birth month and day are before Mary's. The correct answer is option D. Joe, because his birth month and day are before Mary's. Joe's birthday, February 23rd, occurs earlier in the year than Mary's, April 4th. Question 38. When responding to a patient with "How may I help you, Mrs. Jones?" the use of the name. Option A indicates to the caller you are interested in listening. Option B is too formal for an existing patient. Option C violates HIPAA. Option D is too familiar. The correct answer is option A. Indicates to the caller you are interested in listening. Using the patient's name shows attentiveness. Question 39. What does PPO stand for? Option A. Preferred Provider Organization. Option B. Preferred Provider Office. Option C. Potential Provider Opportunity. Option D. Preferred Physician Organization. The correct answer is option A. Preferred Provider Organization. Preferred Provider Organization. Question 40. A PPO patient has a $500 deductible and 80% coverage. If the contracted rate is $2,500, what is the patient responsibility? Option A $1,600. Option B $500. Option C $400. Option D $900. The correct answer is option D, $900. $500 deductible plus 20% of $2,500 to $500 equals $500 plus $400 equals $900. Question 41. If 12,001 was denied as bundled with 123,303 for a 2.6 cm intermediate and 2.5 cm simple repair, what is the correct action? Option A resubmit a corrected claim American Samoa 12032 12,001 to 51. Option B resubmit a corrected claim American Samoa 12032 12,001 to 51. Option C transfer the charge to patient responsibility. Option D write off the charge for 12,001. The correct answer is option B. Resubmit a corrected claim American Samoa 12032 12,001 to 51. Correct coding requires reporting the intermediate repair and the simple repair with appropriate modifiers if applicable. Question 42. What does PA stand for in a clinical setting? Option A physical activity. Option B physician assessment. Option C physician assistant. Option D physical assessment. The correct answer is option C, physician assistant. Physician assistant. Question 43. A new patient sees a physician assistant, PA, for an annual exam. How should services be billed? Option A, bill under the PA. Option B, a new patient can be billed incident to the physician. Option C, the PA cannot see new patients. Option D, reschedule the patient with the physician. The correct answer is option A, bill under the PA. Incident to billing does not apply to new patients, bill under the PA. Question 44. Which of the following indicates the frequency of care on a UB-04 claim form? Option A condition code. Option B MSDRG. Option C revenue code. Option D type of bill. The correct answer is option C, revenue code. Revenue code. Question 45. Which form locator, FL, on the UB-04 is used for the revenue code? Option A FL42. Option B FL5. Option C FL70. Option D FL40. The correct answer is option A, FL42. FL42. Question 46. A claim for $58,260 and $58,720 was returned with $58,720 denied as inclusive. How should this be handled? Option A. A corrected claim should be filed with modifier 50 appended to $58,720. Option B. A corrected claim should be filed with CPT code 58,262. Option C. The charge for $58,720 should be written off as inclusive. Option D. The charge for $58,720 should be transferred to patient responsibility. The correct answer is option B. A corrected claim should be filed with CPT code 58262. 58262 includes the removal of tubes/ovaries. Question 47. For Medicare to cross over to Medigap, what is entered in item 9D on the CMS 1500 form? Option A, plan payer ID followed by Medigap. Option B, a plan name followed by Medigap. Option C, leave blank. Option D, COBA Medigap claim-based identifier, ID. The correct answer is option D. COBA Medigap claim-based identifier, ID. COBA Medigap claim-based identifier, ID. Question 48. What does COBA stand for? Option A, Coordination of Benefits Agreement. Option B, Coordination of Benefits Association. Option C, Collection of Benefits Agreement. Option D, Collection of Benefits Association. The correct answer is option A, Coordination of Benefits Agreement. Coordination of Benefits Agreement. Question 49. How many digits is the COBA Medigap-based identifier? Option A, 4 digits. Option B, 10 digits. Option C, 5 digits. Option D, 8 digits. The correct answer is option C, 5 digits. 5 digits. Question 50. A provider performs an office visit, low MDM, and destroys 2 plantar warts. How is this reported? Option A, 99,213, 17,110 to 59. Option B, 99,213 to 25, 17,110 to 59. Option C, 99,213, 17,110 to 59. Option D, 99,213 to 25, 17,110. The correct answer is option D, 99,213 to 25, 17,110. 99,213 to 25, 17,110. Question 51. What is the correct coding sequence for bilateral tympanostomy, 69,436, and adenotonsillectomy, 42,820? Option A, 69,436 to 50, 42,820. Option B, 42,820, 69,436 to 50. Option C, 694,360 to 50. Option D, 42,820. The correct answer is option B, 42,820, 69,436 to 50. Highest RVU code, 42,820, is listed first. Question 52. Which of the following are requirements for electronic healthcare transaction code sets? Option A, dental services are reported with CDT codes. Option B, inpatient procedures are reported with HCPCS Level 2 codes. Option C, outpatient services are reported with CPT and HCPCS Level 2 codes. Option D, dental services use CDT, and outpatient services use CPT/HCPCS Level 2. The correct answer is option D. Dental services use CDT, and outpatient services use CPT/HCPCS Level 2. I and 4 are correct: dental, CDT, and outpatient, CPT/HCPCS. Question 53. A physician sees a patient in the postoperative period for an unrelated pilonidal cyst. Can an E/M service be billed? Option A. No, report code 99,024 for all services in the postop period. Option B. Yes, with modifier 25. Option C. No, because it falls in the postop period. Option D. Yes, with modifier 24 to indicate it is unrelated to the surgery. The correct answer is option D. Yes, with modifier 24 to indicate it is unrelated to the surgery. Modifier 24 is used for unrelated E/M during postop. Question 54. Which CPT code below can be reported with modifier 51? Option A, 17,312. Option B, 19,126. Option C, 19,101. Option D, 20,697. The correct answer is option C, 19,101. 19,101. Question 55. What is the expected reimbursement for a left maxillary sinus dilation, 31,295, and right diagnostic nasal endoscopy, 31,233? Option A, $2,350. Option B, $250. Option C, $2,475. Option D, $2,600. The correct answer is option C, $2,475. $2,475. Question 56. If both services on a claim should have been paid at 100% but were discounted, what action is required? Option A, contact the payer to reprocess the claim for full payment. Option B, post the payment and adjustment. Option C, file an appeal. Option D, write off the balance. The correct answer is option A, contact the payer to reprocess the claim for full payment. If payment was incorrect, contact the payer to reprocess. Question 57. According to the LCD, how is an extracapsular cataract surgery for a drug-induced cataract in the left eye reported? Option A, 66,984, H26.222, H40.1423. Option B, 66,984, H26.32, T38.0x5A. Option C, 66,983, H26.222. Option D, 66,983, H26.32. The correct answer is option B, 66,984, H26.32, T38.0x5A. 66,984, H26.32, T38.0x5A.